Do you sometimes feel a dull ache in your jaw or notice that one part of your body just doesn't feel as strong as it used to? Maybe your shoulder seems to sink in oddly, or you've had repeated fractures without much injury. These might seem like small issues, but what if your bones are actually vanishing? That's what happens in Gorham-Stout disease, also called disappearing bone disease. Imagine building a house with bricks, but suddenly, some bricks start dissolving into thin air. That's like your bones being slowly eaten away by abnormal cells. It's very rare, only about 200 cases known worldwide, so doctors often miss it at first. But once found, it becomes a race to stop the damage before too much bone is lost. Now, what causes bones to just disappear? Scientists still don't know for sure, but here's the current idea. Your body has cells called osteoclasts. They're like tiny bone cleanup crews. They usually remove old or damaged bone, so new bone can grow. But in Gorham-Stout disease, these cells go into overdrive. It's as if someone pressed the gas pedal and never let go. At the same time, there's a strange growth of lymphatic vessels, the body's fluid drainage system, in the bone. These rogue vessels seem to tell the osteoclasts to keep destroying bone. Why does this happen? We don't know. It's not passed down in families, and it doesn't seem linked to injury or diet. It's like a software bug in your body's bone system, random, rare, and very confusing for doctors. Let's play a quick game. Point to your collarbone, now gently press along it. Does it feel firm? In Gorham-Stout, that firmness might fade over time. You could have swelling, pain, or even a visible dent where the bone used to be. Some people break a bone easily, like slipping on a wet floor and fracturing a rib with a small fall. Others might feel chest pain or shortness of breath if ribs or spine are affected, because your ribs help you breathe. One person might have jaw pain when chewing, while another feels their shoulder droops for no reason. Since symptoms depend on which bone is attacked, it's like a puzzle where each patient has different clues. Kids or young adults often notice it first, but anyone can be affected. How do doctors find a disease that eats bones silently? First, they might take an X-ray. Imagine your bone normally looks like a strong white wall, but in Gorham-Stout parts look like Swiss cheese or even completely gone. Then a CT or MRI scan gives a 3D map of the damage. A biopsy taking a tiny piece of the affected area can confirm if strange lymphatic vessels are invading the bone. Now treatment, there's no magic cure, but doctors act like firefighters trying to stop the spread. They might use medicines like bisphosphonates, which slow bone destruction, or sirolimus, to calm the lymphatic overgrowth. Radiation can help in some cases, and surgeries like bone grafts rebuild what's lost. But it's tricky, like fixing a leaking pipe while the water is still flowing. Can you prevent something you don't see coming? Right now, no. Since we don't know the cause, there's no vaccine or lifestyle change that stops it. But here's what you can do. Pay attention to your body. If a bone hurts for weeks, or you keep getting odd fractures, don't just say I'm clumsy. Talk to a doctor. Early detection can slow damage. Think of it like spotting rust on a car frame. Fix it early, or the whole structure weakens. While we can't prevent the disease yet, we can prevent it from going unnoticed. Good news, science is pushing forward. Researchers are now using gene testing to see if there's a hidden glitch in DNA causing the lymphatic cells to go wild. Some trials are testing sirolimus in more patients, and doctors are sharing global case studies to connect the dots. Imagine doctors from the US, Japan, and Germany all comparing notes on this rare disease. That's happening now. There's even research on blocking the signals that tell lymph vessels to grow into bones. It's still early, but hope is building, like slowly assembling a flashlight to shine light into a very dark corner of medicine.